Action points note that these studies were published as abstracts and presented at a conference. These data and conclusions should be considered to be preliminary until published in a peer-reviewed journal. Girls who played soccer were several times more likely to return to play the same day after sustaining a concussion compared with boys. Note that the American Academy of Pediatrics concussion policy states that athletes should not be returned to play on the same day of concussion, even if they become asymptomatic. Chicago girls who played soccer were more than 400% more likely to return to play the same day after sustaining a concussion compared with boys, researchers reported here. Girls soccer players median age 14 had more than five-fold greater odds of returning to play the same day as they were concussed, albeit with a wide confidence interval or 5.14, 95% psi 1.72, 15.3, according to Aaron Zinda, a research coordinator at Texas Scottish Rite Children's Hospital in Dallas, and colleagues. These findings were particularly concerning because of prior research that found girls who play soccer had a higher rate of concussion than boys, Zinda reported in a presentation at the American Academy of Pediatrics OP annual meeting. The OP policy statement on concussion states that athletes should not be returned to play on the same day of concussion, even if they become asymptomatic. Zinda's group added that there is limited literature that examines whether the medical guidelines and legislation that prohibit athletes from same-day return to play if concussion is suspected are being followed. Natalie Muth, MD, FOP, of the Children's Primary Care Medical Group in Carlsbad, Calif., and Senior Advisor for Healthcare Solutions, American Council on Exercise, said that more research is needed to understand why this is happening. It sparks a call for clinicians to be more vigilant in talking with athletes, especially females, about signs of concussion and the need to let the brain recover before getting back in the game, Muth, who was not involved with the research, told MedPage Today via email. And we need to be more vigilant in our advocacy efforts and work with sports teams and coaches to recognize concussion and follow the guidelines to help protect our kids' brains. Zinda's group performed a retrospective review of 87 patients' ages diagnosed with a success-related concussion at a single pediatric sports medicine center. Patients ranged in age from 7 to 18 years and 2/3 were girls. Overall, 35 patients, 40%, returned to play the same day following concussion, although girls were significantly more likely to do so compared to boys. 30 of 58 girls, 51.7% versus 5 of 29 boys, 17.2%, p. 0.02. Nearly all of those who returned to play did so during the same game or practice, and one returned in a different game later that day, the authors said. A second presentation by Drew Watson, MD, of the University of Wisconsin in Madison, found that teenage girls who did not choose to specialize in a single sport, soccer, had improved sleep quality, better mood, and less fatigue and soreness compared to girls who specialized in one sport. Researchers surveyed 49 female youth soccer players, ages 13 to 18 years, 19 specialized and 30 unspecialized athletes. They were surveyed during a 4-month soccer season, where players reported daily training load, as well as sleep hours. They recorded sleep quality and stressors, including fatigue, soreness and mood, on a scale from 3 worst to 3 best. Specialized was defined as girls who participated in soccer exclusively and previously quit all other sports. There was no difference between specialized and non-specialized athletes in terms of age, years of experience, or incessant training load. After adjusting for age and training load, despite having similar amounts of nightly sleep, about 8 hours apiece, non-specialized athletes had significantly better scores in terms of versus those who specialized in mood. 1.76 versus 1.30, p. 0.017, stress 1.39 versus 0.94, p. 0.037, fatigue 1.55 versus 0.99, p. 0.017, soreness 1.35 versus 0.86, p. 0.003, sleep quality 1.43 versus 1.08p 0.039. Muth said that sports specialization increases the risk for injury and burnout, and said the results were not surprising because pediatricians and sports physicians understand the trend toward early sports specialization is a net negative. But she added that it would be interesting to know the effects of specialization by age, comparing ages 13-15 to ages 16-18. If the results are the same even for the older teens, it raises new questions, Muth said. While we all advise against early specialization, maybe we should really be more adamant in encouraging multi-sport participation throughout adolescence, or at least help families to weigh risks and benefits of sports specialization. Zinda and Watson disclosed no relevant relationships with industry. 19,691,231 to 1,900,500 last updated 09.18.2017.